Hi, my name is Danielle Williams, and the title of my research is Undergraduate Nursing Students' Attitudes Towards the Care of Dying Patients. Unfortunately, death is an undeniable experience that will be faced by each and every professional nurse. Whether we choose to work in an outpatient unit, an inpatient acute care setting, or even a long-term care facility, we will face patient death, either directly or through assisting our patients and their family members in their personal experiences with death. Because of this, I chose to do my research to see if nursing students feel adequately prepared to deal with patient death upon graduation. Through my research, I found that a lack of preparation is an overall theme through pretty much every research article on the subject. So that means that most nursing students don't feel prepared to deal with patient death. And this lack of preparation for patient death can lead to long-lasting negative consequences that may also impact patient care and overall nursing satisfaction. So, because of this, there is a need to understand the undergraduate students' perceptions of death and dying so that we can better prepare them to be professional nurses that can care for patients in each of their experiences. My research question is, do junior and senior nursing students at an undergraduate baccalaureate program in Northeastern New Jersey report feeling emotionally prepared to care for dying patients? I'm also wondering, what are their attitudes towards the care of dying patients? My hypothesis is that participants that are younger and that have less experience in education and little to no religious affiliation will have more negative perceptions of death and dying. I felt this way because I thought that perhaps if students had more preparation or more of a personal belief system, or if they were just older and had more experience overall, they would feel more prepared than those that have no experience on the subject. The overall theoretical framework of my research is guided by Gene Watson's theory of caring. I chose to ground my research in Gene Watson's theory of caring because I'm really more focused on the emotional and caring and psychological aspects of nursing care rather than the physiologic and clinical aspects. Some of the more quantitative data is also guided by a correlational analysis. So for my design and sample, I chose a convenience sample, and it composed of 60 undergraduate nursing students. The survey I used was created by using the Vermelt's Attitude Towards Care of the Dying tool. I contacted Dr. Vermelt and got her approval to use both her tool and her grading system. So I converted this tool into an online anonymous survey that I sent to the undergraduate students via email. Once I had those results, I graded the tool and I used SPSS statistical analysis to perform one-way ANOVA testing, where I analyzed any correlation between the grade levels, the experience level of students, religious affiliation, and age against the tool that I used. I also performed regression testing to see if there's any other correlations between subsets of data. To further guide my study in Watson's theory of caring, I also included an open-ended supplemental question that focused on the students' emotional perceptions of the study overall and on death and dying. The results of my study, I found that there were 50 females and only 10 male students. There were 21 junior students and 39 senior students. The overall highest score possible for the Vermelt's Attitudes Towards Care of the Dying tool is a 150 score, and the lowest possible is a 30 score. My participants, the mean score received was 118. When I performed my one-way ANOVA testing, where I looked at the age, grade level, experience, education, and religious affiliation of students, and their correlation to the attitude towards death scale, I did not find any statistical significance. However, when I ran my regression test, I did find that a subset of data where participants had some education and previous experience with loss had a statistically significant lower attitude towards death scale. I know this by looking at the unstandardized B, which was a negative 6.9. So this means that on average, These subset of students had about 7 points lower than other students on the attitude towards death scale. I then also analyzed my open-ended responses for any themes, and I found 3 particular themes. The first one is feeling and being unprepared or inexperienced. The second was desiring to be supportive or contribute positively. And the third was having negative feelings towards death overall, whether that be from fear overall or from previous experience with death. In the chart, you can see that I have included some of the direct responses from the participants. So to interpret and analyze my results overall, I found that my hypothesis was proven incorrect. This is because I did think that the lower grade level and younger students would have more negative attitudes towards death, but it seems that overall there was a generally positive attitude towards death amongst the participants. However, due to the regression test, it does seem as though students that have previous experience with death have lower scores, which was almost opposite of what I had expected. However, this finding still aligns with the literature that shows that unexpected death can have negative long-term effects. Some possible future studies should focus on the impact of personal death experiences on the professional nurse's role with dying patients. To note some limitations, this study was conducted online. This was because it took place during the COVID-19 pandemic. There is also a poor representation of males, and I tended to have more higher grade level students than lower grade level, which is important to note because I did originally anticipate lower grade level students having lower attitudes towards death scores. Another thing I'd like to note about my study is that due to the open-ended question, I did find that many participants were unprepared or inexperienced with patient death, yet at the same time, they had a desire to be supportive and to contribute positively. This is worth mentioning because it's possible that due to the online setting, I was unable to clarify any questions that students might have had. It's possible that some students might have answered the questions how they would have liked to experience patient death rather than how they truly feel. This could have skewed my data, making it seem like students have generally positive attitudes towards death despite them still feeling inadequately prepared. This is notable because those that did have previous experience with loss and death had negative scores. Overall, regardless of the limitations, this study does contribute to the literature that shows that there is an increased need to talk about the emotional aspects of nursing care, particularly during the education process. Also, this can contribute to the nursing field in that we can use this study and others like it to influence the education and also the support that's found in the workplace during the time of death and dying. Again, I encourage future studies to focus on the relationship between personal experiences with loss and professional experiences. To wrap up, I just would like to note again that death is something that each of us will face in our professional lives. My study may not have contributed the way that I had anticipated, but the findings still hold true in that an emotional focus on patient care and nursing care is essential to the health and well-being of both our patients and nurses. Thank you so much for listening to my presentation. Please email me with any questions. Thank you.